I would like to welcome everyone here. Thank you all for traveling from Topeka, from wherever you came from. I am welcoming dignitaries. We have senators and legislators and pastors and doctors and lawyers, everything. Everybody's here, and I am so glad to see each of you all. Welcome. Now, if anyone needs a Spanish interpreter, those services, they are here.
Buenas noches a todos y por favor tenemos miembros de la comunidad que hablan español. Vamos a estar brindándoles servicios de interpretación. Tenemos los equipos de interpretación simultánea en la parte de adelante. Por favor, si se acercan a tomarlos, se pueden sentar en cualquier lugar después de ello. Muchas gracias y buenas noches.
Gracias, señora. She said more than it, but she was telling everyone where to find the earbuds and where to go. So we thank you all for being here. The purpose of tonight's meeting with this group, we are going to have our people here from KDHE provide outcomes of the health study, discuss the next steps for the next steps, and provide an opportunity for the community to ask questions.
That is much better.
Much better without
Yes, ma'am. Yes, ma'am. Much better without it. Thank you.
So, thank you, sir. He said we'll be quiet and listen. One last thing. I want to introduce, and I've been practicing since I got here, how to say her name. Dr. Farah Ahmed. Okay, all right, good. State epidemiologist and environmental health officer with KDHE to discuss the health study. So, Doctor, oh, I'm sorry. See, number two, I have number two by your name. Janet, her name is Janet Stanek, and she is the secretary of KDHE, and she will introduce her team. All right? All right. All right, thank you.
Hello, everyone. Hello. I'm Janet Stanek. I am the Secretary of KDHE, the Kansas Department of Health and Environment. We're comprised of 3 divisions: Medicaid, Public Health, and Environment. Farah is our environmental epidemiologist as well as our state chief epidemiologist. So we're very happy to have all of you here today. We're here to listen and then try to work forward with you all on this matter of concern. We do have a number of people from KDHE here tonight in the audience to help as needed with questions and whatnot. Leo Henning is our Deputy Secretary of Environment. We've got Farah, who I've already introduced. We've got Randy Carlson from the Environmental Division. Excuse me. We've got, he's environmental remediation or removal. Levi Cook is a geologist who's here. Mary Daly, who you saw earlier with the mic, is a geologist. We've got Matt Lara, he's our Director of Communications and Legislative Affairs. And then we've got Elizabeth Moore, who's also from Environmental and Legislative Affairs in that division. So with that, I'm going to turn it over to Farah so she can start the presentation, which you all came to hear, and then we'll take it from there. And again, we really appreciate you being here tonight.
All right, thank you everyone for being here today. So our agenda is going to consist of, we'll talk a little bit about what a health study is. So when we say health study, what do we mean? We'll talk a little bit about the outcomes of the health study that KDHE conducted. We'll talk a little bit about available community resources and next steps, and then we'll open it up for your questions, and hopefully we'll have some answers for you, okay? So a little bit of background on the KDHE study. So the health study that KDHE conducted is a descriptive study. And what that means is we were trying to describe the frequency of the health outcomes that we were looking at compared to the whole state. So what I mean is we're looking at we're interested in certain health outcomes. How much of that did we see in this community versus the whole county versus the whole state? What is really important to understand is what we didn't do, which is we didn't look at each individual's exposure. So I can't say anything to the effect of, okay, this group that had no exposure, this was their experience. This group that was exposed, this is their experience. That's not what I can do. What I can do is talk to you today about whether or not we saw increases in the health outcomes that we said that we were going to look at. What I can't do is say what might have increased. What were the factors that drove those increases? And for that matter, I can't say anything about if we saw decreases, what are the factors that would have decreased those rates. So I just want to level set expectations here. So we really focused our health study on the outcomes that have the strongest scientific evidence that they could potentially be exposed with, potentially be associated with these exposures, with PCE and TCE. And so when I say, the strongest scientific evidence, it's really important to understand that a lot of what we know about how these chemicals can affect somebody's health comes from studies of people who have been exposed to really high levels, usually through their work. What we know about people who are exposed to lower levels, that's a lot more limited. It's just a limitation of where we are with that science. But we went ahead and we looked at the health outcomes that are pretty strongly associated with high exposures, if that makes sense. What we did was we looked up, 2,700 plus addresses using the cancer registry and using vital statistics records. So that is birth certificates and stillbirth certificates. So those are the two data sources that we use for this study. And what we did was we wanted to look at the number of cases of whatever we're looking at for the population that we're interested in over, a denominator of a population. So essentially we're calculating a rate, right? We want to see if the rate of disease in this community was higher or lower than the county and the state. So that's what we aim to do. So what did we find? We did find an increase in liver and biliary tree cancer. When we dug a little bit deeper into that increase, what we found was that in the area of interest among non-Hispanic Black persons, the increase was more than 2 times higher than in the state. So if you're looking at non-Hispanic Black persons in the area of interest and non-Hispanic Black persons in the whole state, we found a more than 2 times increase in liver and biliary tree cancer. We also found a higher rate of low birth weight babies being born, although over time that rate has been coming down, but it was still higher than the state's rate. We did find a decrease in kidney and renal pelvis cancer, and we did find a decrease in urinary bladder cancer. We didn't find any kind of evidence of increases for any of the other cancers we looked at. We didn't find any kind of increases in the number or types of birth defects, and we didn't find any increases in small for gestational age babies. What that means is babies that are born too small for how old they are when they're born. So we didn't find any increases in that either. So that's what we know. What we don't know. We don't know what might have caused that increase in liver cancer that we found. And we don't know what, if any, potential exposure to the TCE from this spill, the 29th and Gross spill, would contribute to an individual person's health. As far as recommendations go, I think I've said this to a number of people. If you are concerned about your health, your family's health, we really want you to take this information and speak to your provider. So talk about your potential exposure, talk about your concern. And if you don't have a healthcare provider, there is a list of community health resources that is available if you don't already have your own healthcare provider. So I'll just quickly wrap up with a couple of next steps. We are planning, KDHE is planning a second follow-up meeting here in June. We are, I believe, waiting for availability, and then that will get scheduled. The main focus of that June meeting will be to talk about kind of like the next steps for the cleanup and what all still needs to happen for that. And of course, there'll be an opportunity for all of those questions there as well. And then there'll be an update on any information or materials that have come out since then. And for your information, if you're looking for records related to the site, a copy of the study, all of that, it's located at this branch library and at our office in Topeka. So we will have Q&A at the end, I promise. But I want to go ahead and introduce Dr. Minns. This is the Sedgwick County Health Officer, and he would like to say a few words, and then we will move on to Q&A.
Thank you very much. Probably some of you recognize me from past frequent appearances on news programs. And I promise you tonight, I'm not going to mention that bad C word once. I'm not here to talk about that. I hope you're thankful for that. We don't have to talk about it. But hopefully it's a lot less now than it was. C word. COVID. Now I'm talking about COVID. So I just want to give you a brief review of what liver cancer is and talk to you about the causes of it as we currently understand it. As she has just reviewed with you, we saw some increases in the liver cancer. And paradoxically, we saw some decreases in other kinds. Oh my gosh, that doesn't make sense. The human body is mysterious. The human body is very difficult to understand. We're still trying to figure out a lot of things. So, the word liver cancer is a little broad. Most people who have cancer in their liver, because it came from somewhere else. It started in the colon and spread what we call metastatic cancer, where it started in the pancreas and it spread. The liver is a spot where a lot of other organs like the center of cancer. But what we're talking about tonight is liver that began in cancer. The cancer, the liver cells themselves turned into malignant tumors. So that's the kind of cancers we're talking about that seem to be showing an increase. It was mentioned that liver cancer included hepatobiliary cancer. I'm not going to talk about biliary cancer because it's a much smaller proportion of the liver cancers we saw. And what I'm going to tell you in medicine we call hepatocellular carcinoma, cancer of the cells of the liver. Hepatocellular carcinoma, which in the press is called liver cancer, is a common cancer throughout the world. It's one of the more common cancers actually in the world. And it's much more common in some countries than others, which again we don't entirely understand. Possibly due to lifestyle, possibly due to diet, we don't understand it. In our country, we see a fair amount of this kind of cancer. And it's mainly seen in people who have cirrhosis of the liver. Cirrhosis meaning the liver is scarred, and a lot of the cells have died, and the liver has shrunken, and it's not healthy, and it's not doing what it needs to do for the body. In our country, most cases of cirrhosis are due to three main things. Heavy and long-term alcohol use, a virus called hepatitis B that you can get from being exposed to other people with hepatitis B through their blood, through a blood transfusion, which nowadays is a major cost of the test for people who donate, but using needles that other people have used. Or if you're a medic in the military, you've been treating someone who's had a wound and they got hepatitis B, you could get it from them if you're a cancer. And then a second virus called hepatitis C, which is a second completely different virus that if you get, can eventually cause cirrhosis and then lead to hepatocellular carcinoma of the liver. Now the thing that's a little difficult of these things is because you usually have to have any of these threes for quite a while before it develops cirrhosis and liver cancer. And most of the people who have hepatitis B and C don't even know it. Early on, it doesn't cause any symptoms. And you can have it and not even know it. And unless a blood test is done, we don't know you have it. And actually, I see quite a few patients with hepatitis C. Most of them feel fine. And the only way they ever learned they had it is they got a blood test. Nowadays, the CDC suggests that everybody born between 1945 and 65 should have a blood test for it because that seems to be the highest age group that has hepatitis C. But fortunately nowadays we have a good test and it's a fairly easy test to do, just on the blood. The other fortunate thing is screening for cirrhosis for one of these viruses is pretty easy to do. Through meeting your personal provider, physician, asking you a few questions, doing an examination, and then getting proper blood tests that they might decide need to be done because of that examination and history. We can pretty easily diagnose those three main causes. I would like to point out, yes, we saw an increase in liver cancer in some areas, but we actually saw liver cancer almost in every area. It's not a rare cancer. So my point is, even if you don't live in this area where the liver cancer has been going up, there are still cases developing, obviously, because these three conditions we mentioned can cause it without any exposure to chemicals. So I would say, to some extent, depending on your age and your risk factors, you probably ought to see your provider and talk to them about this to see if they agree that you need to be screened for it. All three of these factors, like many things that cause cancer, require heavy and prolonged exposure. So I'll use lung cancer. We know nowadays, it took us a while to figure it out, a number of years, but we know now today that the main cause of lung cancer in our society is tobacco smoking. Never realized that. But you don't get lung cancer from smoking if you just smoke for a year. You have to smoke for a number of years consecutively, and so we mainly see lung cancer in people in their late 50s, 60s, 70s from smoking all those years. Likewise with other chemicals, even if they can cause cancer, it usually takes more intense exposure, not casual exposure once in a while, but intense exposure for a number of years before you would get the cancer. And if you stop the exposure early, your risk of cancer goes way down. So obviously, again, if you have any concerns, I would strongly recommend you talk to your provider. And I think we had people here tonight that can help you. If you don't have a provider, help you find it. So I think that's conclusion slide. If this is a concern to you, if you think you've been exposed, or even if you don't think you've been exposed, but you wonder, maybe could I have C or D or another cause? This thing's find out. And the fortunate thing for nowadays, we didn't have a treatment for FC until, we didn't have a good treatment until maybe the last 6-7 years. And now we have an excellent treatment that can eradicate hepatitis C in almost all patients. Hep B is a little bit more complicated. We'll have to talk that over with your provider. And obviously, alcohol use, if you have that problem. So I'll be able to stick around for a few questions, but I have another engagement, so I will dismiss myself and let the rest of the crew take on after that. I'll turn it over to you.
Oh, all right. So here's the slide that's telling us how we're going to conduct our question and answer session. Step up to the mic. I'll have that. And state your question, of course, and be respectful of others and the time. Allow time for your questions to be answered. Please don't interrupt. And then, of course, we're going to go back to our seat, right? Are there any questions? First of all, for Dr. Ben. All right, we're going to start over here. Go ahead and start coming and lining up. Dr. Menz, we're going to take your... Does anybody have any questions for the doctor before he leaves? Come forward, please, Senator. And then we'll take the rest of the questions. No, we have people who are viewing. They need to hear you. That's why I'm forced.
So, good evening, and thank all of you for coming tonight to present. And Secretary, thank you for coming to my district. Doctor, or for either one of you, so I introduced a bill to address maternal mortality, the death rates of African American children, babies. So can you tell us, elaborate a little bit more on that piece of it? And so Dr. Nims, did you say that those children that were born in this area may still carry or need to be tested or affected by the contaminated area? Thank you.
Thank you, Senator.
It's rare to see a metastatic carcinoma in children. So I don't think that's a big risk in children. And again, the risk factors, things I've talked about, usually not a problem for kids. Now you can, if your mother has hepatitis B, it can be transmitted to the infant. So that would be an exception. But that needs to be talked over with your doctor who's taking care of the pregnancy. I want to say thank you for your service, and I know it's a tough job, so I just want to take the opportunity to thank you for your service.
And mine is for you before you leave. So you mentioned the three types, hepatitis, the two hepatitis, and then cirrhosis. So are you saying that this could be accountable through the TCE, through liver cancer, or what are you saying on those three?
What I was trying to say is liver cancer is common.
Okay.
And the cause in most cases is one of those three things. We don't know how the trichloroethylene,
The TCE.
TCE contributes to that. That is still an unknown in medicine. Does it enhance or speed up the delivery if you have one of those conditions? Don't know. Can it cause it without having those conditions? We don't know.
But right now, we're saying that liver cancer in this particular demographic area is the highest in the state. Is that what I've heard?
No, not highest in the state, was more than 2 times higher than the rate in the state, but not highest in the state.
But it's a lot. But it's a lot. The liver cancer, which could be attributed to cirrhosis of the liver and hepatitis. Thank you.
I've elaborated. If I found 20 cases of liver cancer in this certain neighborhood, probably most of them do one of those three. How much has been added or caused by TCE? I don't know. The jury's still out on that.
Is there another question for Dr. Ben?
Mine is in general. Yeah, how you doing, Doctor? Appreciate your time. So what you just explained to us for me, can you answer to what do you know that contributes to this? Because I seen prolonged exposure. So from my understanding, this has been a 30 to 40-year exposure. So what have you targeted that has increased? You said liver cancer got increased because of way of life or whatever. So what have you targeted from this field, from the exposure of those many decades? Because we're not just talking about 1 year, 5 years, we're talking about decades of exposure. And also, is there anything that you all have done for air exposure? Because of course, when you have a contaminated area, it does, unless you have a bowl placed over it, it contaminates the environment other than just the ground.
I don't know who can discuss the environmental issue.
So you made a couple of good points. You are correct that it's really important to, when we talk about exposure, talk about the route of exposure. That was, one of those slides on that documents talked about. So most people, when we talk about the studies that, about TCE and their health exposure, most people are exposed by drinking contaminated water, right? Thankfully, for the vast majority of the residences in this area, that wasn't the case because we're on city water before we think that the spill occurred. Great. As we talked about in the study and in the previous public meeting, where we are concerned that there could have been a potential exposure is from those lawn and garden wells. So if you had a lawn and garden well that was pulling straight from the contaminated groundwater, then depending on how you were using it, you've got a potential for exposure, right? So for example, if you're using that contaminated water from your lawn and garden well to fill up a wading pool for the summer, right? And you're splashing around in there, you have the potential for a dermal exposure. It's touching your skin, right? You have the potential for, that's where you have a potential for an ingestion exposure, because who doesn't drink pool water, right? Probably drink it more than you get on you, right? If you used it for watering your lawn, for example, the way sprinklers work, they aerosolize those droplets, so there's a potential there for breathing it in. So it is really important to understand that not all routes of exposure are the same, right? Definitely someone who was drinking straight contaminated water for 40 years would be considered to be much more highly exposed than people who might have been exposed off and on by those examples that we talked about. I can repeat the question. The question was how many lawn and garden wells are in the area?
We found about records for about 16 wells. There may be more out there that we don't have records for.
So we found records for 16 wells. There may be more lawn and garden wells out there that we are not aware of, that we're not registered. We have a form over there on the table if anybody is interested in, filling that out to report a location of the water.
Apparently he can multitask. I'm messing with it. Did you hear your answer, sir? All right. We have history, okay? So, Mary. Here you go.
I'll repeat the answer. Mary stated that we know of 16, and I believe there is a form on one of those tables where if you believe that you have a lawn and garden well, then please fill out the form because we are collecting information on that. Did I summarize that right? That's right.
So my question for Dr. Mims, My understanding of the liver is that it filters chemicals within our blood is one of the things that it does. And so if this chemical was in our blood for generations and generations, that would mean that we have long exposure. And so wouldn't that also possibly mean that TCE could have caused us liver cancer?
I'll just answer part of that, and then I will hand it over to Dr. Mintz. So it is really important when understanding the way that TCE breaks down in our bodies. It actually breaks down really well. Most of the TCE that we're exposed to is going to leave in your urine within a day to 3 days. What doesn't leave, if it is kind of circulating in your blood, which is the example that you're talking about, it still is going to continue to break down, and your body's going to try to breathe it out. It's when you are exposed, in that prolonged exposure, when you're exposed continually and your body can't get rid of all of that, that your body could hang on to it. I just wanted to preface that.
1970, we've been exposed for 30 years.
So your answer to your question, yes, the liver is very important, trying to rid the body of various chemicals and substances. And yes, it gets exposed to a lot of chemicals. So again, over a long period of time, it's possible. If this is the cause, that could be one method by which it's affecting the liver. The liver gets pretty heavy dose.
And you also said that if the mother hasn't been exposed to like hepatitis C or anything like that, so if the mother was exposed to TCE, could it also have possibly passed on to the child as well?
I don't know of anything like that. The reason hepatitis B is a problem because it's an active infection. And if the baby gets any you, then the baby carries it until it's either treated or not. That's a little different than chemicals because once the mother gets it, she excretes it. Very little.
Right. But if she's like breathing it in and like consistently on toxic ground, wouldn't that be something that stayed in her with the baby as well?
I don't know that after the baby is born it would stay with it, but during the pregnancy, yes.
All right, thank you. Let me reset this.
About the wells, were any of them shut down?
Before we go on, is there any other questions for me?
I have a question. Actually, it directs toward the exposure of the wells. My family, my husband's family, has a well active. They never had running water until this year. So how are they exposed to this? They drink that water for 60 plus years. They bathe, they ate, use that to cover with for 60 plus years. So they're just not hooked up to city water. How is that exposure to them? How is that
Highly exposed. Highly exposed. That household would be considered much more exposed compared to the examples that we gave earlier, people who just occasionally use their lawn and garden wells.
I'll have another question with that. Okay, so also with that, I have a sister-in-law that passed from pancreatic cancer. My husband had prostate cancer. My mother-in-law had bladder cancer. My father-in-law passed from prostate cancer. 2 other sisters died of cancer. I don't recall what theirs were. How can you say that broke down and for one family, for that many people to die of cancer, not only including the birth effects the birth effects and the miscarriages that they had throughout the family that lived in that household?
I can't make any comment because I don't know the conditions, the specific conditions. That would be something to discuss with your provider, to see if they have other reasons, maybe something that could cause this. The study only showed an increase in liver cancer. They actually saw a decrease in some other types of cancers. So I can't extrapolate to all the different conditions people get as the role of skin problems.
I don't think that's by accident.
So I'll just chime in here because it is, and if I didn't make myself clear in the beginning, I would completely apologize. It is really important to know that what we are able to do in our health study is just talk about the population as a whole, right? So what you're talking about is an individual's family with exposure, with other risk factors. I can't say anything about that individual and to what Dr. Mintz is saying.
But excuse me, but what she was saying is they've been well watered for 16 years. So they're 60. So they're highly contaminated. She's speaking of her family. Yeah, they had the cancer. Look how long they've been drinking this well water.
So like I said, each person needs to decide what their exposure was. If you feel like you've been drinking the well water for that many years, I would say I would feel I'm at a higher risk. So that's what you should do, is go discuss it with your provider. And they can do the test and decide, do you have evidence of atoxicity?
And I believe that we're talking about cumulative effects of the different cumulative effects of these risk factors. And I thank you all for your questions. I am begging you, please come to the microphone so that everyone listening would be able to hear you all. Thank you.
Did we answer about well shut down? Any well shut down?
I believe that no wells were shut down, but if we had tested a well, we gave them advice on whether or not to use it, what purposes to use it for. I don't think the city, we don't have the statutes or anything that allow us to shut a lawn garden well down. The city may have some ordinances that apply to that, and someone from the city might be able to answer that question.
Okay, I'm listening to get with your provider, and a lot of people in the neighborhood area in question. It's not that simple for everybody. We got a common denominator here. We got a contamination that was caused by somebody, and we got people that are affected by it. What can we do to make a provider for these people, make it free?
I'm not supposed to have an opinion, but that would be nice. Who's behind me? Is someone behind me? Did you want to answer that question?
I don't have an answer for that question. So honestly, I don't have a good answer for that question. If there's anyone from the local health department or a local provider or anyone that would like to talk about resources that are available locally, please feel free and I will run you the mic.
I do know that we have providers who Guadalupe does free or for donation health care for people in the community. We have community health clinics that do that. We have doctors who refuse to go on concierge status when they retire. Oh, I'm sorry, I digress. But we do have the resources in the community. They are saying go to your provider. You have to provide a paper trail. Get a paper trail. Find a provider. We're doing all of these studies, but we need to get the paper trail started. Is it? For some it is too late.
I am real disappointed in what was going on up there because I feel like that's not transparency, that's excuses. Exactly. What was going on here, because I don't believe that you're telling us everything after all this time. I do believe, however, that the only reason we're here is because there was a press conference by our elected officials 2 weeks ago and you were forced into this.
Exactly.
Make this community believe you. Explain to them why you hidden from them for so long and they didn't matter until today. I'm so curious right now. Oh, Lisa, help me. I don't think that they should trust you. I don't see why we should. And I had to say this on the media earlier, and it's going to be hard to say now, but there's somebody that was really, really, really important to this community. And she died last year. Had she known this was going on, she would have let us know. So you didn't let them know. Because Dale Finney would have kicked on her high heels and put on her boxing gloves and come out to fight for these people. What are your intentions with them now after all this time?
I'm going to forgive her for saying these people because she's one of us. Right? Who's going to answer that question, please?
I can't answer in detail for the history and what's been going on for years related to cleanup efforts and the communications between KDHE, the city, county. I can assure you that's there. When we refer to the next meeting and things that we're already talking about what we can do different to reassure you that we have been addressing this, it's not always apparent to the community where you would find these types of technical postings of ongoing cleanup and things like that. So one of the things in June that's going to be a core focus is related to what we're going to be doing, not only with this situation, but any go-forward cleanup efforts so that it becomes way more communicated in an effort, in a manner that's perceived to be more transparent. I appreciate your comments very much. I don't have a good answer other than we are hearing you, and that's why we're here. Yes, ma'am.
All right, thank you. She said the people that we're addressing today need an answer and they need it now. If you all would, that's all right. The side conversations is exciting, but we are here to find out what we can do, right? So let's hear that.
So speaking of what we can do, Ms. Stanek, right? Can you please go back to the governor and work on allocating funds to be able to help those who need to be tested and want to be tested, as well as all of the grounds that need to be tested for all the people that would, because it's extremely expensive. And yeah, we can go to our doctors, but I've even heard that not all doctors have the tests. And so we definitely need help in this area. And that is, the cleanup is happening, but what's not happening is our health being affected and then making sure that our grounds are safe as well. And so if you would please go back to the governor and see if you can work that out, and you all work that out for us. That's really what we need as a community.
We hear your request, and I would say again, we are working in partnership with city, county, state government, and UP, the railroad, and all of this is taken under consideration and will be future discussions. So yes, duly noted. Thank you.
Thank you. I'm sorry, I forgot.
The county has just been receiving emails. We're not really mitigating anything or helping to mitigate it. It's city and states right now. City of Wichita. So you say city and county.
Let me clarify what I meant. I just meant we were working in partnership on the entire situation. in related to communications, next steps, and so forth. We're all involved in that. I didn't mean to imply that the county was going to pay for anything.
No, that's not what I'm saying. I'm saying that when we're looking at this, we're looking at city and we're looking at state right now. The county just got read into this, and we are just now beginning to investigate it. We're getting emails and things like that. I know that you've been talking, I hope she's here, to the deputy director. Yeah, I see you. I found you now. Did I say that correctly? We are just in communication with everyone and trying to see where it's like jumping double dutch jump rope. We want to see where we can jump in and help and move about in this situation. So we want to remain in the conversation. We want to remain in solution seeking, but we got to hear from you. It's all right for us to say, for you to tell her to go back and tell the governor this. See, you have a direct line to the governor. Governor works for you. And you. And you. They work for the people. So get in contact with them. Talk to them. And, of course, we don't want to leave you all out. We're not doing that, but we know who to talk to. If I want an issue resolved with the city, I send them an email with pictures. And then I know where they are. Oh, I send it directly to my councilman. Councilman Johnson, Becky Tuttle, whoever's in my district seat. At Levante, help me with this statement. We have neighborhood associations. We have all of these communities. This is why we're working this thing now. The neighborhood associations were sounding the alarm. Where's Ajané? Ajané. Oh, all right, I thought you were going to just be listening. All right, good. Come on now. All right. So what I'm telling you is use your power, use your tongue, use your letters, your emails. We didn't know this was going on. Somebody did. Find out. We're not helpless.
Okay, so I have a couple of questions. I'll just do these two. Because they tie in with each other. Is our community considered a low exposure when it comes to this? And if so, how do you know that?
So, as I kind of tried to explain earlier, when we talk about people who are considered high exposure, don't walk away from me. I have abandoned me. So what we're talking about is, one, the dose, right? So, are you actually exposed to very high concentrations of the chemical? We're talking about how long you've been exposed, and as we've talked about here, decades, right? And we're also talking about how you were exposed, right? Were you drinking it, right? Or were you touching it? Were you inhaling it? So all of that has to be taken into consideration. This family's experience is going to be different from maybe somebody else's who was on city water. Maybe they don't have a lawn and garden well. That's going to be a completely different story. It's going to vary.
Hi, my name is Dr. Val Brown, and I'm an internal medicine specialist. I retired from private practice in 2016. What I do currently is occupational medicine. When I look at the dates and the timeline, I am appalled because in the 80s, that's how old I am. In the 80s, when I first started practicing medicine, I was placed on the city-county board of health. It was a volunteer position, and it was made up of a veterinarian, a doctor, nurses, people from the community. We would not have let something like this slide. We talked about Gilbert and Mosley in those days. You haven't heard that terminology in 30 years. Have any of you heard about Gilbert and Mosley? Some of you who are politically aware, but they cleaned that up because they needed that neighborhood. Okay, so I served in a volunteer status. I was the chairman of the City County Board of Health when we discussed fluoridation of the water. And we found out and realized that in high dose, fluoride is a poison.
Yes, it is.
I never knew that. But we had articles in the paper. What's been in the paper about this? This has been going on for a long time. Let us know. Now, who served as the Board of Health? County commissioners, elected officials who don't live here. Do you see what I'm saying? Why does this have to keep happening to us? Now, this is what I want. The Jubilee, I want a map of Wichita, and I want you to outline this area, because I am having a hard time. I've lived here my whole life, and I can't see all of these streets going every which way, okay? I want you to, and the 16 wells, I want you to put a pin on it. Now, my father, most of you all here know Dr. Val Brown Sr. Dr. Val Brown Sr. dug his own well in his backyard by hand. He had an auger and he was doing this, and he put extensions, and he went 30 feet down to hit water. And Dr. McDonald, the veterinarian that lived across the street, helped him out. I remember TEO, the well valve, the well. Okay? So, who tested my, we used it for sprinkler water, There are other people that dug their own well, put their own pump in, How many of them are there? 16. I think that's a little underestimate. Okay, I'm going to stop preaching.
I had to give him the preacher tap on his back, because he was going, did you see me walk over and just kind of tap him on it? He said, I got to stop preaching. But how many of you all watered your lawn with hoses? We didn't have sprinklers then. We held and we drank the water out of the water hose. There's a lot of things to be considered. We did a lot of that. Played in the water, rolled in the grass.
Hi, my name is W. First I have a comment and then a question. So KDHE has a budget, correct? Why don't we reallocate some funds to help us right now? Do that immediately. That's something I believe is within your power, correct, Secretary?
But I think that's how it was stated about funds. And again, we're going to take that back.
Yeah, I'm saying don't look at it, don't think about it. On Monday, start the process. That's my question. So, in this literature, it talks about legal agreement with Union Pacific. Is there any financial liability for Union Pacific, or is there liability only cleanup?
I can't answer that question, sir.
The legal agreement that we have with Union Pacific requires them to implement the cleanup, to design it and implement it going forward. As far as any kind of liabilities for any kind of exposure, it doesn't cover that kind of thing. I mean, if there were exposures happening that we identified, they would be required to mitigate them. Union Pacific, yes.
Would I still have my legal right to pursue any action against Union Pacific?
I am not an attorney. I cannot answer legal questions.
Okay. And then finally, a question for the county. I know you guys just got rolled into this, but what are you currently doing to assist us?
I'm going to not speak for the health director. She is in the audience. I'm going to use proper protocol and let you speak to it.
Good evening. So what we are working on doing currently, Adrienne Byrne, the City County Health Director. We are working with KDHE, the City of Wichita, to improve the communication because there has not been the communication that needs to occur. We'd like to know what's going on so that we can let you know. If there's remediation going on, to let you know what's going to be going on in your neighborhoods, and when there are chemical spills, and there are a lot that we're hearing across City of Wichita and City County, that we need to let people know what is going on and being transparent about what's going on. And whether you have a well or not, to know what's going on in your neighborhood. And even if you're on city water, to know what is safe to do with a well and what is not safe to do with a well. That is what we're working on.
Yeah, that was a pitiful clap. You're going to clap. Because she meant that. She meant that. And at her disposal, she has people who do research, epidemiologists. She has people who will get out there and dig and find out what's going on. But I cannot stress enough, ladies and gentlemen, the power is in your hand, in your pen, in your phone calls, in your emails. Go down to the library and find out what is the historical data that you can look at. We are not helpless. Hello, sir. We're not helpless. Really.
I'm Ed McNeil. I got here a little bit more about I was administrative aide for the city in the 60s and 70s. We all had problems and issues. And like this one here, it took them 20 years to tell you. And they didn't make any effort to clean it up. And so many times when something like this happens, they bring it to light. And they talk it to death. They never do anything about it. 9 years ago, this week, they discovered the water in Michigan. And they haven't done anything, but they've talked about it.
There have been cleanup efforts going on at the site since 2004. They've done accelerated remediation technology wells. They've done excavation of the contaminated soil where the spill occurred. They've instituted a bioremediation system where the spill occurred, and then the hydraulic control system along Murdoch Avenue. So there's been remediation going on since 2004 on this spill site and throughout the area.
So I have a question, if I may. How does that get communicated to the populace? The work that's being done, how does that get communicated to the population, to your constituents? Or, her constituents?
Well, we do have publicly available databases. I guess people are not as aware of them as we would like them to be. That's something that we have our webpage now for what's been going on at that site. It has quite a bit of information on it. We have placed documents, the primary documents for the site, at the Angelou branch of the public library here on 21st Street. So a lot of that information is available for people to go look at will.
I'll just add on, and I don't mean to keep referring to the future meeting, but what Mary's describing is KDHE's process and what we do. We have a lot of partners throughout the state, through a lot of communities. Information's passed on to the city and so forth. What we're going to talk about, what we've started those discussions with the city about, is what can we do different to make sure going forward that it's above and beyond anything we thought maybe we were doing and had that available. So we hear you loud and clear. The information has been there. Reassured the cleanup has been going on, like Mary said, but that is going to be the focus of the June discussion. Thank you.
Yes, my question, we're talking about TCE here. My question is, during this study,
have you been studying also the other carcinogenic, cancer-causing chemicals that are involved in this field? Because we don't need a scientist to tell us there are more carcinogenic chemicals in this field than just TCE.
And feel free to chime in. The two chemicals that were found in the groundwater contamination are TCE and PCE, one of which is attributable to the Union Pacific spill site, and one of them which is likely attributable or likely caused by old dry cleaning sites. So when I looked at the health outcomes of the health study, I took into consideration both of those. And so they do act very similarly, so there is a lot of overlap in the kinds of health effects that they can cause. So I can't tease out and say this was caused by this and this was caused by this, but we did take them into consideration. You're right, there was more than TCE.
Heads up, people. The Stockyards was near my home. Come closer, you all. Stockyards was over there. The oil refinery was over there. Train spilled some stuff. You guys just go and research things, all right? And then ask your questions and be ready for June. We're already telling you, they are already telling you. I have lived experience in that area, except for the 2 years that I was in Chicago. It's about a little over 60 years over there on 20th and Kansas and 24th Street. So I'm invested in this.
You're talking about groundwater contamination, and I guess my question is, being a chemicals come in three forms: solid, gas. What is to preclude TCE from leaching into the soil, and also in the vapor form? Most of the houses in the area have basements. Would this not have, the vapors have accumulated in basements, come through the homes through the vents and things of that sort, mixed with molds and other chemicals and bacteria, microbes, cause some effects. I've heard that there's no way of saying whether TCE was contributable, and this is kind of like a shoulder shrug. Is there going to be anything done to research and find out if that's so, and not just an answer of, I don't know, we'll see. And then what I was hearing about a larger rate of liver cancer in the affected area, I'm hearing, oh, well, hepatitis, A, B, C, D, F, Y, C, and sclerosis, a lot of this may be caused by alcohol consumption or other bad behaviors, needle sharing and things of this sort that cause hepatitis. There's airborne hepatitis, I'm kind of hearing, well, our high rate in our area may be caused to our behaviors,
So there were some vapor intrusion testing done early on the project. They've done three different events of indoor air testing. Most of that was at the area north of 21st Street. Our guidance document for indoor air evaluations, or vapor intrusion evaluations, says we need to go back and recheck that periodically, and there are plans in the works for another round of that kind of evaluation. And we'll be talking about that at the June meeting. The original testing that was done, the one in 2009 and 2013-14 timeframe, we did not find any concerns in the houses and the buildings that were tested. But again, we're going back. We're going to have Union Pacific go back and reevaluate that as our guidance recommends.
and we'll talk about more about that in the June meeting.
I'll answer the second part of that question. I didn't mean for it to sound like it was a shrug of the shoulders. I just wanted to be very clear about what the study that we conducted could answer for you and what it couldn't, because I didn't want to overstate what I could do, right? So I'm sorry if it came across as a shoulder shrug. That is not what it meant to be. I just didn't want, if someone was thinking that this study was going to answer questions like, I was exposed at this level, does that mean that this is my risk? That's not what this study does. So that's one thing. The other part of your comment about risk factors and are we essentially blaming the community? Absolutely not. And where Dr. Mintz was going with that is we found an increase, right? We found an increase in liver cancer. There are a lot of risk factors that can increase liver cancer. So this is a conversation that has to happen with your provider. Part of that conversation is your potential exposure. But that provider is going to need to screen for cirrhosis, which is, something that leads to liver cancer. What he was talking about are the most common in the U.S. factors for most of the cirrhosis that he sees, and he's talking about his experience. So we're absolutely not talking about this is the fault of anybody. And so there are a number of risk factors, and that's what he was trying to talk about.
At least she gave me a smile. Now listen, I am thinking of social determinants of health, some of which we are in control of and some of which are controlled for us. Our environment, our built structures. I remember growing up that we used to cover our windows with plastic to keep the cold out, right? And that was to help us to control the temperature in the room. I'm thinking, did gas come up in there and accumulate and concentrate and that kind of thing? So please consider that when you are thinking about the area in which we live. She mentioned mold, another mitigating factor for breathing, etc. So that's all I have to say as a facilitator.
Good evening, everyone. I've heard a lot of things today here. First of all, we didn't come here to talk about hepatitis C. We didn't come here to talk about cirrhosis of the liver. We came here to talk about TCE and the effects that it can have on the people that have been exposed for over 4 decades. That's what we came here to talk about. Don't be distracted, my people. Don't be distracted with the things they say. In 1994, KDHE entered into a consent decree with the city of Wichita. The city accepted the responsibility to clean up Gilbert and Mosley Street and also the 21st Industrial Quarter with no money in their budget to do it. But they found the money to clean up Gilbert Street and Mosley, and they have invested not one penny in the 21st Street Industrial Quarter, not one penny. But they made that agreement with the EPA and KDHE. They did. So when they tell you what they're gonna do, I don't know. It's been 40 years. Nobody told us. I had to find this out at a meeting of so-called remediation. And they were gonna make their decision then, and none of y'all would have had anything to say about it. I told them, wait, we can't make that decision until we understand what are you remediating, what happened. But for them to know this from 1994 up until 2000, and 22, because I didn't find out till September 7th, 2022. They just don't care. They just don't care. They can't tell me they don't know, and they entered into an agreement to clean it up, but they didn't do it. So you can't say you didn't know anymore. As far as this health study stuff, you talk about the biliary tree. Well, that's your pancreas. That involves your pancreas. It involves your gallbladder. It involves other parts of your body that they don't want to talk about. Yes, it does. The biliary tree involves the pancreas and the gallbladder. Yes, it does. Yes, it does. Kidney cancer is prevalent over here. I don't care what they studies say. And my daddy didn't drink, didn't smoke. I never even heard him say a dirty word. Now, he needed Jesus just like the rest of it. But he suffered with cancer for 12 years. First, prostate cancer. The Lord blessed him to get through that. Then we look up, and here comes kidney cancer. And what does it do? It migrates to his liver and other parts of his body. And not only him, but two other men on the same one short dead-end block that I grew up on. Right over here in Minnesota, right around the corner. McFarland in Minneapolis, that's where I grew up. Okay? They want to talk about short-term exposure. There's no such thing for us. We've been here since the 60s. Some of us may be longer than that. So how short-term is that? That's not short-term. That's a long time. Why does everybody want to tap me on the shoulder?
Telling the truth.
Because you don't want to hear what I got to say.
They don't want to hear the truth.
Okay? We're going to hear it today.
Amen.
I'm tired of this. I'm tired of the treatment. I'm tired of these charade conversations. Charades, how you want to pronounce it. It's all a facade. It doesn't mean anything. You're talking about resources. Well, what you're saying is, if you are sick, go talk to your doctor. It ain't our responsibility. That's what I keep hearing.
Right.
Talk to your doctor. That's what you keep saying. Well, you know what? If any of us out here has cirrhosis of the liver or hepatitis C or any other hepatitis, we know that because we didn't talk to the doctor. So I don't want to hear no more stuff. If you can't tell me some factual stuff, like I just told you, then I don't want to hear nothing else.
The reason I'm trying to get the mic is because it's 8:30 and I'm sleepy. And the meeting, hold on, I did a funeral today, so we're all in here busy. Thank God for each of you all. But check this out. I'm going to go through this line and it'll be it, I think. Yes. And then I will turn the mic back over to you, Ms. Jenny. That's all right. Who said that? Sarcastic. We have a solution. Okay. Thank you.
So I guess I got to state my name. My name is Coach Tracy C. Mason, Senior Youth Advocate. So first and foremost, no disrespect to any of you and your positions and titles, but in the June meeting, can you have those that can make immediate decisions show up? I ask that, request that, because I understand that you actually did the legwork, so now we need to build answers to move forward on. When I was young, well, they leave, but they not, these ones are involved in the work. This is for the ones that we need to understand this. We need to understand that there is nothing but black people in here. We need to understand that this affected the black community. We need to understand that once again, we're third-rate citizens. Once again, this happened. I remember this first initial spillage when I was a child, and the adults talked about allow the boom and all type of stuff, stay in the house. Here I am, 55 years old, 40 plus years later, and I remember being a child eating up more cookies than I was supposed to. And I have 5 other brothers and sisters. So when Mama said, who ate these cookies? I ain't gonna say nothing because I got 5 other brothers and sisters. The only reason why we're here is not because the cookies got ate, it's because they got caught. It's because they got caught. Understand, there's not enough people in here. They did a study and they had almost 2,000 people that they did a research on. Well, 3,000 people have lived in this community since the last 40 years. So understand this, community. When are we going to unify to get direct, immediate answers? They cleaned up these areas, these other areas of concern, because it was their money that was getting messed up. Now that they don't mess up their money, they ain't got no problem. You please do you will, and I'm going to come to a conclusion, because I don't want to disregard any time. But y'all listen, at some point, we got to galvanize and unite and get real answers and solutions. We don't even have warning signs where these wells are and where these so-called contaminated areas are today. Flint, Michigan, water went unresolved and still is unresolved. Are we going to be Flint, Michigan? Are we going to be Flint, Michigan? So all of you that have roles, whether you're quiet or loud or whatever, somebody knew, and you know those somebody that do know. Please go get the answers and get the names, and let's get the ball rolling for solutions, not talk. Again, June, can we get those here that can make immediate decisions? Thank you.
I'm coming to you. Now, those of you all who are leaders, thank you for coming. I want to respect everybody that's been in line.
I've been in this community for 66 years. Just a quick comment. I honestly feel personally, I don't know about any of you, I feel like we're owed an apology to Union Pacific, KDHE, and whoever else was involved with the failure to properly communicate with us. Me personally, I am sick and tired of us being undervalued, underestimated, and marginalized.
Thank you very much. Thank you. Hello.
Hello, I'm Kent Rowe, and I've been involved with the water contamination in this area, this immediate area, since 1981, whereupon I was fired from the health department for talking about this contamination that occurred, that ended my career in public health service. But that's all right. I persevered. I am sorry if I let you down, but I left the country after that, lived overseas. But I come back and I see that nothing's been done, and obviously one of your most precious natural resources in this community has been highly contaminated. That is what I'm here to address right now. The pumping of the water requires electricity, and that is probably the greatest expense for the cleanup. Where does that electricity originate? It comes from the utility, our monopoly that we have here. I would say, why can't we use our community-generated electricity to run these pumps? And more than just 8 wells, is that what I see on the map now? 16 or so? We could probably double that, get 2 times wells. We could probably double that and cut the cost greatly. And I don't think our monopoly utility company is going to cooperate there. And we're also faced with another source of air pollution and power line and incursion down in the Mossman Avenue. So we're having an event at ISIS Church on June 30th to show you how to generate your own electricity away from the grid. It is your own, you own it. You can transport it, disassemble it, and move it to where you want to have it for the next time. Yeah. Thank you. June 30th, ISIS Church.
They corrected you, sir, it's IASIS, but he's attending, so he's like over there.
I just have a quick question. I'm Venus, and my question is, once we screen and diagnose, since we're telling everybody to see their providers and we're happy to see them, are you going to give us the ability financially to treat them? Because the diagnosis is just the first part of it. We have to be able to treat them. We're Grace Med, and we want to see any and everybody. We're willing to do our part, but I just want to make sure that somebody is willing to do their part and help us take care of them beyond the diagnosis. That's what I want.
When I said, tell them who you are, she said, I'm Venus. I'm like, nah, Venus, ED or CEO of Grace Med. Yes, thank you.
I have another quick question. My name is Marie Florence. Not only this is affecting our health, this is also affecting our property values. We can't sell our homes with this contamination. So those of us that can have our health tested, but we can't do anything with our homes, that's a loss. And they already undervalued our homes. So we have lost, health-wise, financially wise, and now we're losing our homes. And that's very stressful. And you guys are saying, you know this since 2019. Some of us that moved into this community would have never bought if we'd known this. My mother-in-law and father-in-law, 60 years plus. Dr. Brown, our next door neighbor. We have lost, health-wise, family-wise, financially-wise. And you're saying you're not going to do anything? And you can clean up other communities? But we're looked as nothing. Nobody. And you won't even bring the people that can answer the questions. That hurts. That's saying you're not doing anything. Because you can't have people here to give us the answers that we need today. June, you should have everybody here. These questions should be ready to be answered, dealt with, treated like adults.
Wow. Okay, see, I saw you coming. She's the last one. Oh, it's come here, baby.
I can talk about you when I say
Hey everyone, I'm LaWanda DeShazer, and let's not forget the facts that we were given. 2 times higher than the state of Kansas. Let's not forget that. The whole state. And I'm going to take you back to 1940s real quick. Black folks, we live downtown. We got pushed from downtown. We own downtown. Go to see Ark Valley Lodge. We were moved to this area. Remember that. On top of contamination starting in 1940. Let's not forget that. Right, so don't forget that. So our community was built on top of contamination. Let's not forget that. And so when we come in June, let's bring some attorneys. Let's do some class action lawsuits. Some people have died. Some people, kids grew up without their mothers and fathers and grandpas. Let's not forget that. They tested homes in 2009. What about 2001? What about 1994? What about 1970s? Kids grew up in that neighborhood back in the days when we played everywhere. We didn't just stay, we ate everything. Somebody might have grew, what we say, tomatoes, and every kid ate them. And you know when kids took the water hose and drank it, they took whatever because they were kids. Last time we were here, somebody talked about the black sludge that people played in. So let's not forget, we were moved to this area on top of contamination. They knew about it. Homes were built. People moved in there. Kids played and ran around everywhere. So when we come back in June, let's have our own answers. Let's have some attorneys here. I bet Union Pacific is in this room, but they're not saying anything. Union Pacific, they fought it, right? And somebody said, Sedgwick County has served as our Board of Health for a long time. Everybody is responsible. Let's do a class action lawsuit, y'all.
I thank you. Now, when he finishes, when I tapped him on his back, I said, "Are you free?" If you are a preacher, I'm gonna hold the microphone because I know us. No. All right. He's gonna. All right. I'm. You know, Diana Ross would give Michael the microphone. Remember that?
So for those of you who don't know who I am, I'm a Kansas State Representative for Carr for the 84th District. I could be a preacher. I just kind of want to reiterate some of the things that some of the previous speakers spoke about. Most specifically, that young lady that just left, who happened to have lost a husband, which was part of what she left out of that statement. A young man that I went to school with, and I believe she lost him to this same liver cancer that we're talking about here today. So I would be remiss if I didn't mention that, and I know you didn't want to say it yourself, so I thought I would make a point to mention that for you. I had a meeting earlier today with members of the Union Pacific Railroad, where at which time we spoke about the cleanup efforts and what they were doing with regard to the cleanup. I've mentioned this once before in the news conference, and I'll mention it again today, most specifically because we've got people here from the KDHE. That particular area, the ground zero site, according to the last test, there is still contamination in that area, and I know that kids play up there. So we need, I mentioned this the last time, maybe you didn't get the memo, but we need some signs, not tomorrow, we need them today, right? Letting people know that that area up there is contaminated. We can put them in the park to keep the children from going back beyond that wooded area and playing. I know that kids play behind that wooded area because I grew up on 25th Street, which would just be 4 short blocks from the contamination ground zero site, and I played there as a child myself. I have to wonder whether or not I may need some of this medical screening. And now that I'm speaking about the medical screening, that I keep hearing the words, talk to your medical provider, talk to your medical provider. Everyone may not have a medical provider, and certainly everyone may not have the financial means to pay said medical provider. The young lady from Grace Med, Venus, who spoke earlier and offered the services of her facility to do these tests, even though we didn't go beyond that. What we need to do, and you can certainly get with me, I'll call the governor myself, but we need to provide funding so that her group can take these, everyone in this community, because we all need testing, right? And I say we all because I grew up here. So when we come back for that particular June date, we need to have that worked out. I'll leave you with my card, you call me, we'll work this part out because we need to be certain that these people don't avoid being tested, and I say these people, I'm talking about us, okay? That's okay, I'll give it to you. I need to be certain that we don't avoid the testing simply because we don't have the financial means to get that done. In addition to that, we spoke about those wells. Someone named 16 of them. As a child, I can think of 3 or 4 that I drank out of personally down on Minnesota. We also need to make a concise effort so that we go door to door, if that's what it takes. We need to go door to door, knocking and asking to find out if they have a well, because the then owners of those properties are likely deceased. You know, many of my friends that live down there, where I know they had those wells, those were Sandpoint wells. I helped dig one myself. You start with the hammer and you finish it, just twisting and grinding. You know, I don't know how we would know unless someone told us that it was there. So I recommend that we go door to door to find out. Because when someone else moves in, all they'll do is turn on the water. You know, they may never know that there's a pump somewhere that's pumping this water up for them. So we need to take care of that. You know, I too am upset. It's been a long time, you know, too long. And again, this community has always been at the bottom of the list and nobody cares. I can't promise you that I would do or would be capable of doing, you know, any work that someone may have done before me or after me, but what I can promise you is that I'll work like hell to get this done. So I'm going to leave you with my card, okay? And you contact me, we'll contact the governor, and we'll coordinate with Venus. You know, our first step is to make sure that we get everybody tested. And at this point, I'll give you that microphone back.
No, I'm not taking any more questions. I'm not taking any more questions. Yes, sir, thank you.
Thank you, everyone, for attending. We will be back in June. Please let us know what we missed so that we will be back with writing information for you in June.